So PARP inhibitors are a new class of chemotherapy agent that affect changes in what we call mismatch repair genes. The specific ones that are important for PARP inhibitors are BRCA1 and BRCA2. Those are pretty publicly known as the genes we think about for breast and ovarian cancer and families. Genes that there can be a change that's handed down from mom or dad to daughter or son to your sisters, your brothers, and can affect your risk of cancer. So that is one type of change that can occur, what we call a germline or familial mutation. If those occur, PARP inhibitors can be useful. Also, if there's a loss of one of the genes, what we call a loss of heterozygosity, a loss of difference, then PARP inhibitors can be effective. If there's what we call a somatic mutation or a gene mutation in a patient's tumor itself, the patient has no family members that have any cancers. If you check their DNA across their body, there's no BRCA1 or BRCA2 changes, but you look in the tumor and it has those changes, then a PARP inhibitor can be effective. Also, if the genes are turned off, that means the genes look normal when you sequence them, but there's a light switch that we call methylation that's turned off. If that occurs, then PARP inhibitors can be effective also. These overall changes we've shown in papers occur about 20% of the time. And so these are the people in which PARP inhibitors can be useful. The one caveat to that is we've also learned, based on data that's been done by several people like Dr. Manahan, that shows there is tumor heterozygosity. What's that mean? Tumors are heterogeneous. They show changes throughout their course. The first time there's a tumor, you may have a change. The next time it comes back, it may have gone back to normal. So even if you have a germline mutation or a familial mutation in BRCA1 or BRCA2, before you get a PARP inhibitor, you should really have the current recurrence of disease checked, because these tumors may have mutated back to normal. There can be greater than 11,000 genetic changes in a tumor at a time. We thought 11,000 was great. Now some of the data is showing that there can be even greater number of changes. So it's really important to check what's going on right now, this time, to know if an agent such as a PARP inhibitor is going to be useful.